Cochise County is a beautiful place to live. It's very peaceful. There is a lot of wide open space. In theory, because of our access to the outdoors and open spaces, you would think we would have a longer life expectancy. Unfortunately, the statistics don't support that. The reality is that we are very far from specialty care. So if you happen to have a diagnosis, let's say, of type 1 insulin-dependent diabetes or cancer, lung disease, or if you're a child born with a complex, medical syndrome, the nearest specialists are in Tucson. My older sister and younger brother and I were raised by a single parent. My mother is actually a Cuban refugee to this country. When I was 8 years old, I actually started having symptoms of extreme thirst, couldn't go anywhere without having to stop and use a restroom, and started losing weight. Turned out that I was diagnosed with insulin-dependent diabetes, but basically my life was going to depend on a medication, a very important medication, insulin. And essentially my life would depend on a healthcare system. Watching my mother try to navigate through all of that, not being from this country, I think was part of the reason why I wanted to go into medicine. So I'm on my way to the Wilcox Clinic today after several years of not coming to see patients. But we just opened our modular last month, and so I'm coming once a month. I've been, working as a pediatrician for many years in Cochise County, and so I have some patients I've been seeing for several years.
Tengo que hacer estiramientos, caminar con él y programarme en el día para que él pueda caminar aproximadamente 5 horas diarias para ayudar a sus músculos que no se contraigan. Desgraciadamente en el pueblo de Wilcox la terapia física para los niños como nuestros hijos no se las dan, solo adultos. Entonces él tiene que tomar una terapia cada 15 días. Entonces viajamos hacia allá.
It's one thing to address access to affordable health care and making sure that people have the primary and preventive services that they need for a growing population. There's other social determinants that contribute to some of the challenges and the poor health outcomes that we see in rural areas, including things like how far is it to the nearest place where you can get health care? Do you have reliable transportation? Cochise County is a population of about 125,000. HR1, also known as OBA, or the One Big Beautiful Bill Act, had some changes that are concerning. The immediate concern is that it did not renew the advanced premium tax credits for the Affordable Care Act marketplace. Longer term, one of the anxieties for counties, especially a county like Cochise, that has 30% of its population that depends on Medicaid for coverage. Starting in January 2027, so not very far down the road, there's new eligibility, enrollment, and redetermination processes for staying on Medicaid. And it's estimated that as many as 250 to 400,000 Arizonans will lose their Medicaid coverage because of those new requirements.
I see the cuts to Medicaid both hurting us as an institution and our viability financially, but definitely as a huge detriment to the patients. There is going to be a delay in care, especially with our adult population. I would anticipate they're not going to come in unless they're really sick. And often that means the disease is very advanced.
Many of the clinics and hospitals operate on 1% to 2% fiscal margins, and this will put a great deal of stress when 10 to 20% of the people that they take care of no longer have a source of payment for their health insurance and for the type of services they provide. It was about 17 pages in the One Big Beautiful Bill Act, or HR1, of the 870 pages total. But that 17 pages had to do with the Real Health Transformation Program. And that is a true opportunity for the state. So the state just received an award from the Center for Medicare and Medicaid Services of $167 million a year for the next 5 years.
At this point in time, we don't really know how that's going to play out. We're happy to see that there's a recognition that we need additional support to do what we are trying to do. But how exactly that's going to be dispersed and to what programming, I think that's still yet to be determined.
But that money can help with things like, let's make sure that we transform how we train health professionals to include places that are in high need for nurses and physicians and dentists and behavioral health providers.
There was one visit in particular. I was 15 years old, and I was going to see the pediatric endocrinologist for my diabetes. I was sitting on the exam table and he was looking right at me and into my eyes. I actually can still remember his eyes. It's a very vivid memory. And he said, "Do you want to lose your legs and become blind? Why are you ignoring your diabetes?" And I just left that visit in tears. I thought, oh my gosh, why am I even trying? This is, it's not worth it. And that specific visit has guided my approach to being a pediatrician, probably my whole life. Gosh. After that, I basically said, I will never, no matter what, I will never make my patients feel like that. What gets me up every morning are my patients, I would say. I really, truly love them. I mean, been here 15 years. I've seen many of them grow up, especially as a pediatrician, and they are my motivation. They definitely are.
Hi, I'm Tom McNamara, host of Arizona Illustrated. Thank you for watching this story from our show. And for more local content from Arizona Illustrated, just click right here.